Dr. N. Krishnan, a visionary. Many inspired him in the field of healthcare, which sowed seeds of taking up a career in medicine. Uncle Dr. Krishnan did his undergraduation in medicine at Stanley Medical College, Chennai. He did his master's in ophthalmology at JJM Medical College, Davangere, Karnataka. He was curious in continuous learning and mastered surgical skills very soon. A meeting with Dr. S.S. Badrinath, his mentor, made Uncle Dr. Krishnan get a rare opportunity to get trained further and work abroad and joined Shankara Nethralaya. He did his fellowship in glaucoma and became a consultant in glaucoma service. He had many national and international paper presentations and scientific publications to his credit, which added more feathers to his cap. Icing the cake was the original research paper on the effect of mitomycin C and 5-fluorouracil anti-cancer medications on recalcitrant glaucoma, considered meritorious at different platforms in various countries. Well-experienced Uncle Dr. Krishnan, keen on serving the underprivileged, started Frontline Eye Hospital at Avarpet, Chennai, and simultaneously 2 satellite centers at Ambattur and Karaikudi in 1994, beginning his mission to save the vision of millions of people. Uncle Dr. Krishnan's contribution in ophthalmology have saved several lives through his monthly free eye camps, free medical and surgical camps in rural and tribal areas, vision screening which covered more than 1 lakh of school children. His one word to success is commitment. The most recent Carnal, a new charitable trust, is a continuation of his thought process conceived way back in 1994. Uncle Dr. Krishnan, the founder trustee of Carnal, formed a team of noble-hearted eminent trustees to give vision to the needy in the Karaikudi Sivaganga region with the support extended from Kovilur Mutt. Kovilur Eye Hospital, which is of international standard, will be a hallmark in eye care, research, training, and rehabilitation in this part of India, attracting everyone around. Uncle Dr. Krishnan's ancestral bungalow in his hometown is now a new home for several ophthalmologists and vision care professionals. Uncle Dr. Krishnan's wholehearted and concrete effort to bring in a complete change is an inspiration, and he has so much more in his pockets to fill the needy with light by giving sight.
Good morning, Uncle. It is my pleasure to welcome you to the 6th episode of Live a Smart Life Doctor Series from Hiranya Medical Service. You are a top-notch ophthalmic surgeon, extending your service to society by creating health awareness and improving medical facilities in and around Chettinad through Carnal. As the founder managing trustee of Carnal, you're taking the efforts to offer eye care education and vision screening for school children at free of cost. So could you please tell us more about this initiative, Uncle?
Good morning. Thank you, Hiranya. And before I could start answering your questions, I wanted to appreciate you. And it's for the viewers. Hiranya is a fantastic child. I've been just observing her right from her childhood. And she has got an excellent academic career and her records are good. And she's not only academically brilliant, and she's very good in other fields also. I appreciate her voice, the way she sings, the way she participates. And now, beyond everything, really, I appreciate her real interest to passing on the information, medical information to the common public. So her medical service is totally, what I can say, it's not for profit. It's only to educate the patients. And even at this stage, somebody getting this kind of idea has to be really appreciated. Really appreciate Hiranya for your effort, and I wish it grows many folds. All the best.
Thank you so much, Uncle. Thank you.
Right. And coming back to a question, this is something I had a passion like you, right? From your young age, you have a very good interest towards serving the people. So it's in blood, right? So nobody might have taught you. It's your own interest that you wanted to start this service and you are going and doing the service. In every field you're involved. So like that, when I just started my career in ophthalmology, when I became an eye surgeon, it's my mother's wish I should do this for people who can't afford. That's the reason I went back to Chettinad. Not only that, even in Chennai, when I started, vision rehabilitation and social outreach wing is one of the component of my clinic right from day one.
Wow, that's very nice to know about Colonel Uncle. That's a great initiative. Eyesight being a very important special sense, I chose to discuss with you about the common eye problems and prevention. So I posted on social media regarding this program and received several questions that I would like to ask you today on their behalf. And the first few questions are from Mrs. Radhika Santosh, India, regarding glaucoma. Is glaucoma an inherited condition? What are the symptoms and by what age do they manifest?
But it's a good question. Glaucoma is invariably inherited, and it can also be sporadic. Unfortunately, it's a dangerous disease in the sense there is no symptoms experienced by the patients. And that's why it's called silent thief of vision. So the patient will not know they have glaucoma unless they go for eye checkup. It's such a silent issue which totally spoils your vision without giving any kind of symptoms. That's a funny part of glaucoma. That's why one has to be careful. And clinically, it can be diagnosed by doing certain kind of tests. Symptom-wise, what we can tell patients are, somebody might say frequently, I'm changing my glasses, spectacles like. So that kind of a refractive error maybe at times can be noticed. And this is in the chronic type of glaucoma. Whereas in acute type, where the outlet channel is narrow, there will be a sudden rise in the intraocular pressure. There patients might have some symptoms like redness, pain, headache, sudden blurring of vision. So that is in the narrow angle glaucoma, they call it. In the chronic simple glaucoma, unfortunately, there is no symptoms at all. So since it's hereditary, there is a family history of glaucoma, all the family members needs to go for a periodical eye checkup, especially when they reach 40 years of age.
Okay, so it's actually interesting. I didn't know that it was a silent theft in terms of chronic. So coming on to her next question, is there a certain group of patients, for example, diabetic patients, that are higher risk of glaucoma?
Yes, it is possible. Certain kind of systemic conditions precipitates glaucoma, or the incidence of glaucoma is more in this kind of patients, like people having diabetes, hypertension, or more predisposed for developing glaucoma. All this relates to perfusion at the retinal level, right? So the diabetes, hypertension, again, interferes with the retinal circulation, and age is another factor which really disturbs the perfusion at the ganglion level in the retina. So these are all the other reasons for the visual loss as far as the glaucoma is concerned.
Okay. Okay, so what are some precautions that these people with, higher risk could take care of so that they can prevent glaucoma?
Yes, they need to keep their blood pressure, sugar, cholesterol, everything under control. Apart from all this, they need to have a special interest towards maintaining their hemoglobin percentage. That's what personally I insist with all my patients, right? So hemoglobin is something, it's very important thing like petrol for a car. And that has to be maintained. And death of nerve cells is more common apart from other systemic factors in anemic patients. So as far as the glaucoma is concerned, the neuronal loss, though your intraocular pressure is under control, your glaucoma is strictly under control, there is 1 to 2% of visual loss because of other reasons like systemic factors.
Okay, okay. And there's another question regarding glaucoma from Jason Ha, Korea. He has said that his grandmother is suffering from glaucoma for the past 2 years and would like to know what lifestyle changes and medications can be given to treat her condition so that it does not get worse.
Good. Here, no need to be a drastic change in the lifestyle of any age group, I'll say, unless otherwise their field of vision is compromised. Normally, they need to keep their general parameters like hypertension, diabetes, and lipids under control. And they need to be regular in applying the medications, the compliance from the patient's point of view. That's very important. Apart from that, there don't be any special kind of care glaucoma is concerned. It's only the periodical checkup and follow the instruction by the attending glaucoma consultant.
Okay, so when you say periodical checkup, how often should the people go and check, like, their eye care?
Yes. The periodical in the sense depends upon the status of the optic nerve and how well the intraocular pressure is controlled and the field of vision. So this is under the discretion of the attending glaucoma specialist who will tell what is the periodicity, right? If the pressure is under control, it might vary even 1 month to 3 months, if not even every week till the intraocular pressure is kept under control. So the periodicity is decided by the attending physician. But once everything is under control, normally it will be monthly or just maybe once in 3 months of periodicity. It varies from one person to another, depending upon the clinical situation.
Okay. Okay, Uncle. So moving on to the next topic, which is diabetes in relation to the eyes. There's a question from Ria Raj, Dubai. How can people with diabetes preserve their retina and prevent early vision-related problems?
As far as the diabetes is concerned, nothing but controlling the blood sugar level. That's very important. And apart from that, associated systemic factors like hypertension and lipids has to be necessarily kept under control. And again, depending upon the retinal situation, the evaluation of the retina by the retina specialist is very important. Mm-hmm. And that is once in 6 months or once in a year, like that. And since diabetes are predisposed to develop glaucoma, during their visit to their ophthalmologist, invariably the eye pressure is also taken care of. So control of the systemic conditions and periodical eye checkup is sufficient. No need for any other medications to prevent. diabetes related changes. So the control of diabetes is very important, and periodical examination is very important. And for the diabetes, it's not the severity of the diabetes is more important, it's the longevity of the diabetes in a particular patient is very important, and they have to be a little more careful when the diabetic age is more.
Okay. Okay, Uncle. And moving on to the next question related to diabetes. So this is from Mr. Ganeshan Karunanidhi, Singapore. Will ARED2 formulas, raw carrots, and eye exercise help to protect the eyes in people who have diabetes?
Good. It helps. It helps in the sense, as I told you now, so control of systemic condition is very, very essential. Apart from this ARED is nothing but lutein and zeaxanthin. They are nothing but carotids. These are good antioxidants which helps to keep the retinal cells intact against free radicals. That way it helps. Apart from this, naturally available vitamin A and improved protein intake helps.
How about eye exercise, Uncle? Like, is there any particular exercise that patients?
Yeah, when it comes to eye exercise, I always say, particularly eye exercise is very important for pediatric age group, where children have some kind of imbalance in their extraocular muscle conditions. So when the eye is not orthophoric or when they're squinting, so certain kind of an orthoptic exercises might help. Otherwise, for a normal person, no need for any kind of special exercises. So routine movements in our day-to-day activities is sufficient, provided the patient is normal. And this kind of exercise helps in the children who have got some kind of orthoptic issues.
Okay. Okay, Uncle. So we'll move to the next topic, which is cataract. And Mr. Ravi from India would like to know, what is the importance of removing cataract?
Good. See, the cataract is something normally the crystalline lens inside the eye is transparent, through which you can see, like you are able to see through a transparent glass piece. When it becomes translucent, opaque, we can't see. See, cataract is something like inside the eye, the lens which becomes opaque. So a person who is developing cataract progressively loses the clarity of vision. And depending upon his visual requirement, he needs to go for the remedy. So remedy for cataract is only removal and replacing it with intraocular implants, where the quality of vision, depending upon the patient's requirement, can be improved upon. So the cataract removal and lens implant is a choice. The timing of surgery is decided by the patient depending upon their visual requirement.
Okay. And the next question that I have here is a very interesting service-oriented question that I'd received from Mr. N.S. Rajan from India. He is 70 years old and he has undergone cataract surgery for both the eyes. And he would like to know about the guidelines regarding donation of his eyes.
Excellent. This really, I wanted to just maybe talk about this also. It's an excellent question. See, because there's a lot of lacking in this kind of eye donations to match the requirement at present. So only 25% of the donor sites are available for the requirement at present. There is no restriction as far as the donor is concerned, but only thing, this has to be performed by the other family members, your kith and kin, you are going to be around, right? So we need to keep our desire to be aware of, right, to the family members. So they are the people who are going to fulfill your wish. That is the most important fact. Not necessarily one who wants to donate his eyes after his lifetime needs to register his eyes in an eye bank. Like that is again another kind of a thinking that I haven't registered. Like not necessary that you have to register, but only your kith and kin should be aware of your wish, and this should be performed within 6 hours of one's demise. And anybody can donate, but certain kind of infectious situation, the tissues are not used for transplant, but it's used for research purposes. So anybody can donate, and they classify the tissues according to the health conditions of the cornea, right? They have the endothelial count. Depending upon the count, they classify the quality of the tissue. So just to honor the wish of the deceased, we never refuse any of the donor's eyes. We receive it, and depending upon the situation, we'll decide. Only people who are with infectious disease cannot donate, but it's not refused. We have the discrimination of using it. This is to respect the wish of the deceased, because the thought is noble, so we need to respect them.
Yes, Uncle, definitely. This is a very, interesting and noble question that everyone would ask. So it's nice that you clarified the question. Okay, so moving on to the next question, which is from Mrs. Melanie Champion, Australia. She's saying, babies cannot explain what they visualize. So how are eye conditions diagnosed?
Yes. So we have a procedure. So this is called evaluation under anesthesia. So children may not be cooperative. We can't perform the test on them. So this is performed only on children who require some kind of a special examination. So this is done under general anesthesia. We give a short GA, something like that. So we anesthetize a child, then perform the examination required. So now as a routine, it is being done in most of the clinical situations, like to rule out our retinopathy of prematurity and glaucoma evaluation, all this done under general anesthesia. So it can be done to the perfection, right? Like an adult. Like in an adult, we can do a clear, thorough examination for the pediatric age group also. This is done under general anesthesia.
Okay.
Yes.
Okay, that's interesting. Yeah. So next question is regarding technology. And Anjali from India would like to know, are mobile apps effective in testing refractive errors and pupillary reflexes?
Good. So I'm also equally fascinated to know the developing area. This area is developing very much. Mm. Now people started to improvise the clinical facility, how it can reach the doorsteps of every patient. So this is going to be possible in future. To some extent, it's being carried out at present. So refractive error maybe in future can be assessed online, but now visual acuity is being measured. Definitely now we can assess pupillary reaction also, thanks to the technology. And shortly we'll be able to do even the refractive error also, refraction online. Now the visual acuity, we are able to. But refraction, maybe the future will tell the answer.
Okay, so going on to the next question from Shyam Sundar, India. Blue rays affect the circadian rhythm. Is it possible for a person to return to normal sleep pattern after exposure to blue rays?
It's an excellent question. Really, I wanted to highlight this aspect wherever I go speak of late. During this pandemic, this is a problem faced by every individual. See, not only the sleep pattern, this blue end of the light spectrum invariably affects neurons at any level. So as far as seeing is concerned, it immediately affects the neuron at the retina and also at the occipital cortex. But for corona and this pandemic, this topic would have been taken the main stage everywhere. But unfortunately, because of this COVID and this pandemic, this has taken the backseat. Invariably, the blue end of the light spectrum affects the eye. And it affects more the dark adopted eyes. Dark adopted eyes in the sense when you watch blue end of the light spectrum in a dimly lit room, it affects more. So a lot of studies going on, and one has to be very careful about this. And they need to restrict viewing screens in the dimly lit areas, and number of hours they look at the screen also should be minimized. Mm-hmm. This has to be followed. The consequences are really very bad. That's one thing about the blue end of the light spectrum. And the sleep pattern, I'll say it's only a conditioned reflex. Anytime it can be reverted to somebody's comfort. So this is modified according to their requirement. So anytime that can be reverted. And this blue end of the light spectrum, it's not only a phototoxic, but beyond that, it's a lot more, which is being worked upon at present everywhere. So this is going to be the future topic. So let us all watch and let us not get trapped by this blue lights and the fancy for the screens.
Yes, Uncle. Okay, so we're moving on to the next topic, which is myopia. Mrs. Lois Low from Singapore asks, as we age, how to reduce myopia without increasing the degrees, and how can myopia be prevented?
Good. Being a Singaporean, it's a very good question, right? And you know, myopia is prevalent there. And I appreciate the Singapore government, which has been doing and did a lot of research on this. And Singapore government also did a fantastic study on atropine in the school population, and really appreciate the government's move to screen the children, I think 4 times in a year if I'm right. And hats off to the government, and they're doing a very great job. And yes, coming to the question, can you repeat the question, please?
Yeah, sure, Uncle. So as we age, how do we reduce myopia without increasing the degree?
Yes. Good question. But basically, I'll say the genetic factor plays a vital role in myopia. Of late, a lot of studies cut into this genetic factor. I won't say trying to disprove, maybe prove other theories. And this atropine study is one of the very important kind of a study recently happened, where the pediatric age groups are targeted. And again, axial myopia was a criteria. And the methodology was different concentration of atropine. And it was fixed initially 1 year, 2 year to the maximum of 3rd year. And with this, it was found out in the age group of 6 to 10 years, axial myopia can be restricted to the tune of 0.5 mm growth in a year, which is a fantastic result and needs a lot of, follow-up, and more studies are taking place. We are waiting eagerly what's going to happen.
Mm-hmm. And how can myopia be prevented? That's our next question.
Yes. I don't know, just maybe whether it can be prevented. As I personally strongly feel the genetic factor is more influential in myopia rather than anything else.
Okay.
So I used to tell, let it be myopia or hyperopia, it's all the configuration of the eye. Any configuration can be strengthened, cannot be altered, because its genetic factor is more stronger rather than anything else. So how can it be altered? We don't know. That's why I said we are looking forward for the atropine study results.
Mm-hmm.
So there are different age groups, different concentration, different durations are studied in different populations. And we are eagerly waiting for the results that will say whether myopia can be arrested or the progression can be restricted. We don't know. Because atropine works in a different way. They say in this age group of 5 to 10, by giving atropine and paralyzing the ciliary muscles, active accommodation is paralyzed. So lengthening of the eyeball is prevented. So that's a thought prevailing, which paved way for the studies. So we need to wait to watch the result.
Right. Okay. I think you kind of covered like the next question that Lavanya Reddy from India has. So her question was, in children with high myopia, why is atropine not given to control myopic progression? Would you like to?
I have answered this also. Good. Well, it's a good topic because hats off to Singaporean government, which did a tremendous job on this. And me being a glaucoma specialist, I eagerly watch for the results. That's not my area, but it's an interesting area. So let us not look for it.
Yeah, sure, Uncle. And she does have a few more questions regarding LASIK. So the first one is, can LASIK stop the retinal issues that a person with high myope can develop? And why is LASIK not suggested more commonly to patients in India?
Good. So, different questions put into one. Fine. The LASIK is different, which is to maybe remove the spectacle or shorten the eyeball, and by reducing the myopia. This otherwise a cosmetic correction for the myopic refractive error. That is LASIK, which has got nothing to do with the retina or changes in the retina because of the myopia. Myopic degeneration, it's again got a big genetic influence along with the degree of myopia. So like either the myopia, mild myopia is less likely to have retinal changes. Moderate to malignant or high myopia is likely to have more retinal changes. So these are all to a certain extent related with the degree of myopia or the number. But no way connected with the LASIK. LASIK is only to shorten the corneal curvature and reduce the power.
Okay.
I think I covered the question, whatever was asked, right?
Yeah. And is there any reason for why LASIK is not more commonly suggested to patients in India?
Okay. Anyhow, I am not really having that data, why it is not. But as far as I am concerned, actually, this kind of treatment, say like LASIK, now it has gone to improve to many. From LASIK, it has gone to what do you call it, a SMILE procedure, right? So keyhole kind of a surgery without kind of a much intervention. And it's not, I don't suggest anyone to go for LASIK unless patient asks for.
Okay.
So this is, I used to feel it should not be advised, it should be asked for, something like contact lens. It depends upon the person who wants, maybe cosmetically or for reasons, maybe we give them. These are all the choices available for the patient to get corrected their refractive error. They can use glasses, they can use contacts, they can go for LASIK like. So here in India, why it's not corrected and the number is not more, I don't know. Just maybe the patient is not opting for it, but India is one of the earliest to start this procedure. And the number is plenty, but maybe it's a costlier treatment anywhere in the world. And maybe affordability may come into play a role. But the number, certainly I will not say it's low in India. The number is quite sufficient, right? Number of patients are getting the LASIK done here.
Okay. Yes, Uncle. Thank you for your opinion on that. So moving on to the next question from Ellis Rabin, Trinidad and Tobago. Her question is about astigmatism. So what is that and how does wearing glasses help that condition?
Astigmatism, this is something, astigmatism can be two different ways. Where the refractive surface is not uniformly smooth. The first and foremost surface which refracts the light that enters the eye is your cornea, black part of the eye. The second area where it gets refracted is anterior crystalline lens surface. If both the surfaces are not homogeneous or smooth, the light rays pass through these two medias will not be refracted uniformly. Depending upon the change in the surface, each ray is refracted differently they never get focused in a single point in the retina, which is essential to see a clear image.
Mm-hmm.
So when the corneal surface is irregular, each ray falling in different points will be refracted differently. So the each ray entering cornea will be differently focused in the back part of the eye retina, giving a blurred image. This is corrected by giving an appropriate lenses in front of the eye to focus all the rays on a single point in the retina, where the patient can see a clear image.
Okay. Mm-hmm.
If the surface is not going to be uniformly smooth in the anterior crystalline surface, the anterior surface of the crystalline lens, again the same problem, refraction. It's not going to get focused on a single point. And that cannot be corrected with your spectacles or contact lens, where removal of the crystalline lens is essential to make this patient see clearly. So these are the two things which will cause astigmatism in a normal patient.
Okay. Okay, Uncle. So moving on to the next topic, which is regarding COVID-19. This is from Wesley, United Kingdom. How does COVID-19 infect the eyes, and what are the most common signs and symptoms?
Good. This is again a viral infection of the eye. It depends upon the part of the eye which gets infected because of the virus. For you say it's a COVID-19. This is something like even when you get common cold, you get some kind of a redness in your eye. You have watering. You can't look at bright light. And these kind of symptoms happens with minimal changes because of any viral infection. And the mucar, this kind of a fungal kind of a thing is that depends upon the place where the secondary fungal infection takes place. That's what recently threatened the vision, depending upon the place it happens. Otherwise, it's like any other common viral infection in the eye.
Okay. Yes, Uncle. So I would like to end with a question that I have. We students get very less time to sleep because we have a lot to study, that to studying medicine online during this COVID pandemic with our electronic devices. So what advice do you have for us students to reduce our stress on the eye?
Good. This really, I would be interested in answering this, because all children, all students should give importance to the answer I'm going to give for this question. The first and foremost is eat well, sleep well. The second thing I used to tell is minimize your screen time. And still, to maintain the level of comfort all through the period you work online, one has to necessarily blink periodically.
Mm-hmm.
So when you stare at the screen, the blinking rate is reduced. Naturally, your cornea gets dried up. So we have a 20-20 rule. So look at the screen for 20 minutes. Please blink yourself for a second. Just close your eyes and open. That wets the corneal epithelium. Your eyes are going to be comfortable. Another tip, what I would like to give all people who are glued to the screen, or invariably their nature of work is related to the screens. When you work for 20 minutes or 30 minutes, you have to, as I told you, the 20-20 rule, blink. The another one is look at something far, then immediately look at something near, close your eyes, then look into your screen. When you look at far and near and close your eyes, see the ciliary muscle relaxes. right, which acts like a zoom in the camera, which helps to see things clearer, gets fatigue after some time if it's going to be constantly at work. So when you look at far and near, it relaxes and constricts. Okay, one cycle is broken. So your eye muscles recharged. So the fatigueness is totally relieved. Mm-hmm. So this is going to help you. This one.
Okay, Uncle. Yes, definitely. I think these tips are very useful, especially the 20-20 rule. I've never heard of that. So that's very interesting and I'll try it out. So thank you so much, Uncle, for taking the time today to share your experience as well as answer all the questions received by Hiranya Medical Service. I learned a lot today about how to take care of our eye in all aspects. And I'm sure this video will benefit many people. So I really appreciate your time, Uncle. Thank you very much.
Thank you, Hiranya. I also appreciate you. At this young age, really you are committed to the profession, right? And all the best.
Thank you so much, Uncle.